Okay, my name is George Semel. I'm a plastic surgeon. I've been in Beverly Hills for many, many years, and I've seen many, many changes occur in plastic surgery on my watch. The key things that are very exciting about plastic surgery are that you don't have to do as much to get the same result. A lot of people talk about minimally invasive surgery, but when they're talking about minimally invasive surgery, they're not talking about short incisions. They're talking about really not doing the whole job. If you don't do a whole job, it doesn't last very long. A good facelift can last 12 or 15 years unless you're over 65 or 70, when it might last a little less. If you're starting out late, then it's like double tuning a piano. You know, if you tune a piano on time, the tuning lasts a very long time. If you start late, then sometimes you have a little bit of a touch-up that's built in the next year or two. And a good surgeon can tell you if you're at that risk. It's better to touch it up and have very, very short incisions that don't spoil your life and let people know that you've had surgery than to have a very extensive surgery that alters you. Okay, when you pull up, it's entirely forgiving, and it's really very hard to pull up too tight. Now you'll notice that the neck goes up. If you pull on your face, I don't care what condition you're in, you pull back here, you're really very tight back here. It's the scars behind your ears that ruin your life because you have to have your hair down. You can't come out of a shower wet and look like a normal person, and you don't need to be here. Now, if you're in really terrible shape, you might have to go up twice, as I was talking about, a double tuning of a piano, but that is not most people. It is some people, and the thing is, the idea is to inform you. A proper facelift incision goes along here, goes inside the ear, and wraps the ear just a little bit. From that access, if you are patient, if you use hypotensive anesthesia, which I'll explain later, and you've done it before, you can go all the way to the bottom of the neck and get the entire neck clean and pulled as it should be. You can tighten these muscles and do all the appropriate work. When you do a lunchtime lift, they're taking a suture, they're doing a little pull here or a little pull there. A lot of the benefit is swelling. That's why they tell you it'll only last a year or two, because by the time the swelling goes down, they haven't really done the work. And this is not to disparage another surgeon, it's to discuss method. You have to have a thorough job done, and a thorough job can be done with little period of convalescence. The way that's accomplished is with glues. Let me tell you a little bit about glue. There was a guy named Curtis Arts who ran a training program when I was a kid, and they were working with cyanoacrylate, which became super glue. And cyanoacrylate was used in the tent operating rooms in Vietnam because the technique of war at the time was to injure and to use up all your resources. They weren't trying to maim people and make examples, but they were trying to tie up all your resources. And so the bursts tend to break into the livers, and young men who could live would bleed to death from their liver. When you put cyanoacrylate on the liver bleeding stopped, and they could then live to go on. Now, cyanoacrylate inside the body drains, and that's why they were slow to take on the use of glue. It later became
Action.
it became a useful product when people began to use it for the skin and just hold it together. I believe it was first used in Holland and then gradually spread to the United States. When you hold a skin wound together that's of course been held together perfectly and use glue instead of sutures or use few sutures, you have the advantage of having an adhesive that is holding the skin together until it heals, because as the skin exfoliates, the glue falls off. It's very much more pleasant for the patient because sutures can't hurt. It's very good for the patient because it seals the wound, and they can take a shower, they can live their life normally, and the possibility of bacteria getting in and having an infection is diminished. Now, a second type of glue began to be used in the mid-'80s. Right now you can buy it as fibrin glue, and it's a product that you just order from a store. But in the very beginning, and I was involved in the beginning, we began to use fresh frozen plasma. Now, fresh frozen plasma is the yellow stuff. You remember when you scraped your knee when you were a kid and you had yellow stuff? It's the yellow stuff. And what it does is, in the presence of thrombin, which is a blood clotting material, forms an adhesive. The advantage of using glue are two things. When you're doing a facelift, or when you're doing eyelids, before you trim the skin, the eyelids are really measured more accurately than a facelift. When you're doing a facelift, you can actually take the glue and hold it and glue the entire thing together without trimming any skin. And you can stand back and take a look, and you can see if it's symmetrical, and you can see if you like it. And then if you really like it, great. You go ahead and finish your surgery and trim your skin and close it, both with glue and sutures. And you tighten your muscles as you should. You do all the necessary steps. But the thing is, if you don't like it, you're stuck with it. The patient is stuck with it if it isn't right, or you've gone too far back, or you've gone not enough up. You can't change it because you're cooked. And so it creates a great safety factor. Now, the other thing that I like about this is that you can take the bandage off the next day, and the patient sees their result, and they're not frightened to death. Having a facelift, you feel totally well. You go in, you have surgery, you're trusting your life to someone and your appearance, and it's really nice to know the next day that it came out right, that everything is moving, that you're really not bruised, and that you look like yourself, or you look like your younger self, and you don't have to worry about it anymore. If you take the bandage off the next day, there just isn't time to become concerned about what happened in surgery. And it's a very nice technique, and it gets you back to work quickly. So the thing is that when we do people from out of town, we can have them back on a plane, barring any complication, barring anything. In 9 days, they can be on a plane and be back to work. We had a trial lawyer try a case 2 weeks post-op. I'm not saying that's the most practical way to approach it, but the thing is that you can be back to work and taking care of yourself in a very short time with the use of adhesives. The cost of a facelift is a very different thing than people think. People price shop. The idea is to get it done right. Whoever does you first with the short incision is going to make your life, because whoever follows is going to have to follow that pattern. If the incisions are done well and they don't show, you don't have to share with anyone. You want to share, that's your business. But when somebody turns around to you at dinner and they see scars on your ear, what are you going to say? Oh, I had an accident. A tiger bit me on the way to work. I mean, how are you going to explain it? It's just not a good thing. So the thing is that the undetectability of surgery is really critical. And those are the prices. The emotional prices of surgery are prices of surgery. The other thing is that you need to heal quickly. And with the use of adhesives, you can heal quickly. Now, there is another thing that we do in surgery that most people do not do, and that's called hypotensive anesthesia. Hypotensive anesthesia began when they began to do the hearts, and because you couldn't really work underwater. And although heart surgery is much more complicated, you want to bring the best of it to a much less complicated surgery. You want to bring all the advances of surgery to the arena when you're having your surgery. You want to be in the most modern, most up-to-date, and have everything put in your favor so that all you have to do is lie down and wake up. It's not quite like a manicure, but the thing is, if the surgeon does his work, there's not a lot of post-op care, and you will not be frightened, and you'll be happy with the result. You need to look at your old pictures, and you need to bring them with you, because you need to match the lips and the fullness of the lips and everything to make you look like yourself, not to look like a tight person. When you tighten the face and you don't address this aspect of the face, you have the look of being pulled. If the lips are full, you look much better.